Hello,
Well,
everyone.
please.
Thank you. Hello, everyone. My name is Natalie Thompson, and I'd like to welcome you to this Interpride podcast on Mpox and Pride. And as we get started, I'd love to give you all an introduction to Interpride to give you a little bit more information about who we are, and then introduce you to our esteemed honored guest today. So, Interpride, what we do is we bring together pride organizations from around the world, as well as regional, national, and local pride networks. We have over 375 member organizations in over 70 countries. Our work impacts millions of people worldwide through our membership. Interpride is also the owner of World Pride brand, our Interpod brand, and the Global Voices of Pride podcast. So I'd like to thank you all for being here. Just wanted to give you a little bit of an introduction on Interpride and welcome our esteemed guest. I'd like to first welcome Admiral Rachel Levine, who serves as the 17th Assistant Secretary for Health for the U.S. Department of Health and Human Services and is the head of the U.S. Public Health Service Commission Corps. I'd like to send it over to you, Admiral Levine, to give our opening remarks for today.
Well, thank you very much, Natalie. And I am just really pleased to be here and to join my friend and colleague, Dr. Demetre Daskalakis, who will be following me. So I am Admiral Rachel Levine, she, her pronouns, and I am so honored to serve as the Assistant Secretary for Health at the Department of Health and Human Services and the head of the United States Public Health Service Commission Corps. I am delighted to join Interpride and to share some of the work that my office, the Office of the Assistant Secretary for Health, is doing to support our vision of healthy people, healthy communities, and a healthy nation for all. OASH is leading key HHS policy initiatives and working across the federal government as a convener and as a source of expert information to advance health equity in all of its programs. Advancing LGBTQI+ equality and improving the public health for LGBTQI+ people is an integral part, a key part of our mission. Now, Healthy People 2030, which is in our portfolio, defines health equity as the attainment of the highest levels of health for all people. And I have said many times, I firmly believe that we have not made progress, we have not made true progress, unless we have all made progress. Achieving health equity requires valuing everyone, and that means making focused and ongoing societal efforts to end inequalities, to eliminate the impacts of historical, contemporary injustices, and to improve the social determinants of health for the public. HHS is working diligently to fully implement the President's executive order to advance policies that improve the health and wellness of LGBTQI+ people who live in America. And we are making significant progress. Last year, I announced that the United States Public Health Service Commission Corps would end its medical exclusion for people living with HIV and hepatitis B. The FDA announced yesterday guidance that will replace the deferral for men who have sex with men for blood donation and an individual risk assessment where all people will be asked the same questions. And SAMHSA released a new report that outlines the harm of conversion therapy, and more progress is coming. Now, I know Demetre is going to go into more detail, but I want to highlight a few important topics. We are going to continue the fight against HIV stigma, and we are going to work to end the HIV epidemic in the United States. The FDA approved the first long-acting HIV PrEP medication, and the administration utilized a whole-of-government approach to slowing the spread of Mpox. And I want to sincerely thank, again, my friend and colleague, Dr. Daskalakis, for his untiring efforts on this issue. Now, as we learn more about the new cases of Mpox in people who are vaccinated in Chicago, we may need to use other tools in the Mpox prevention toolkit. With the 2023 Pride season coming, it is critical that we stay resolved in promoting Mpox vaccine as well as other prevention strategies. Vaccination is an important tool in stopping the spread of Mpox. Although not perfect, the vaccine is very effective in preventing the infection and many of its complications. Now, getting tested if you have a rash is important, and avoiding close skin-on-skin contact or sexual contact with anyone with a rash, regardless of prior vaccination, will also help us prevent the spread. It's going to take everyone's commitment to successfully end HIV and Mpox. And as you are preparing for Pride season, I know we all are, we encourage you to continue to prioritize Mpox vaccination for the LGBTQI plus community as part of good sexual health services that include HIV and STI prevention, testing, and treatment. We need to make sure that our community is ready for a healthy and joyous Pride season as summer. As Pride organizers, you all have incredible power to support public health initiatives that lead to a healthier LGBTQI plus community. Pride festivals have always been on the forefront of HIV prevention for years by bringing testing on site. Many Pride festivals have gone smoke-free to help address the smoking disparities that cause grave harm to our LGBTQI plus community. And similarly, with Mpox, Pride organizers can help us slow the spread by partnering with your local and state health departments, or partnering with CDC directly, as Demetre will review and discuss. We need to make sure that Mpox prevention and vaccines are part of your ongoing Pride planning. Now, I remain a positive and optimistic person, and I believe that working together, we can create a better future for all of us living in the United States. And I am hopeful for a more inclusive future because of the work organizations like Interpride are doing and all of your member organizations are doing every single day. And I know that most of your organizations are volunteer run. It is a lot of work. I know that. And your work makes people feel seen and valid for being just who they are. I know they do for me. The truth is that we have not made progress unless we have all made progress, and we all have a role in making that happen. We must strongly advocate for the most underserved and marginalized in our community, including trans youth, trans seniors, trans immigrants, and particularly trans women of color who are at risk not just of discrimination or harassment, they are at risk of violence and murder. Everyone should be able to live their lives in any part of this country, no matter who you are, no matter who you love. I remain positive and optimistic, and I want to leave you with a message of hope. There is a place for all of us. There is a place for you in this great country of ours. When faced with hate, I choose to find love in our work to help people live a healthier life. I choose to focus on what is within our power, whether it is at the policy level or one supportive adult making a difference in someone else's life. You know, there's a study by the Trevor Project that making a difference in a young person's life and making a difference even in terms of their suicide risk involves one caring adult in that young person's life. That might be their parent or their relative, but it might not be. Maybe it's you. One caring adult in that young person's life can make all the difference. Now, I want to share a quote that I heard from White House Press Secretary Karine Jean-Pierre. It's that, quote, "Your identity is not your weakness. It is your superpower." I think that that is great. We all have superpower according to our identity. We're all superheroes. We do not realize the impact that we have all on the world around us through our actions, big and small. We don't often realize that right away, but we are a strong community. We are a resilient community, and we're going to maximize the impact of all of our work by working together. Thank you so much. It was just my pleasure to be here, and I'll turn things back to Natalie and then Demetre. Thank you.
Thank you so much, Admiral Levine. It was really amazing to have you here to begin our presentation, and what a strong message of that one caring adult that could make a difference and that our identities are our superpowers. Thank you for really gracing us with that message this morning as we go through this presentation today. So thank you again. I would now like to pass it over to Dr. Demetre Daskalakis to really talk with us about Mpox and give us an overview and then a chance for our community members to really ask questions to get to know more about it and how you all as individuals can really help stop the spread, really help to educate yourselves, and for us to be really diligent about our health and well-being. So, Dr. Demetre, just as a brief intro of you, Dr. Demetre is an infectious disease physician who serves as the deputy coordinator of the White House National Mpox Response. And so, the utmost expert, we come to you for all of your knowledge and information to really help us be good stewards of our own health and our community.
Great. Thank you so much. Just making sure my slides are up, and then I'll get started. Can you see them yet?
Yes, they are up.
Perfect. So, thank you again, Natalie. Thank you, Interpride. Thank you so much, Admiral Levine. I've got to say, the team with Admiral Levine's office and the White House Mpox response office really has changed the course of this outbreak, and it's been really just such a great pleasure because it's so important that we actually leverage the amazing work that prides do every day because they really give people the power to be the superheroes. So look at this call and look at this presentation. Get ready for the nerdy moment. We're going to call you to the Hall of Justice, superheroes. We need your help. I want to start before I pass the mic over to Nikki Romanek by introducing Dr. Romanek, who is our senior policy advisor at the White House for the National Mpox Response and just an excellent ally and friend that's really been so critical in making sure that we get the message out. So we're going to share duty on this presentation. So I'm going to pass it right over to Dr. Romanek to start.
Thank you very much for that warm welcome. I just want to second what Dr. Daskalakis just mentioned. Admiral Levine has been a tireless and incredible advocate for this community, and it's been an honor and a pleasure to work with her, along with Dr. Daskalakis. All right, starting off with the state of epidemiology for Mpox. Good morning, good afternoon, or good evening, depending on where you guys are all watching from. Next slide. All right, the situation update as of May 10th, 2023. Currently, we have 30,395 total confirmed cases of Mpox in the United States. In addition, we have 42 total deaths. On this slide, you'll see that on the map, the darker areas represent areas with more cases. Next slide, please. Here we have the 7-day daily average epidemiologic curve. An epi curve, for those that don't know, is a graph with cases by day, which are the bars, that is averaged out by a line. And on this graph, you'll see that blue dark line. Currently, the cases represent 95% cisgender men, around 3% cisgender women, 0.2% transgender men, 0.8% transgender women, and the rest is for all other identities. Ages, I know that's a little bit hard to see, but ages tend to be younger on the spectrum, well, relatively younger, depending on what you think young is. Cases are usually around 45 years of age or below. The highest bar on that blue graph on the right-hand side is actually ages 31 to 35 years old. And in the middle, you'll see a colorful graph. That is actually the race ethnicity breakdown for Mpox cases. Most cases historically during this outbreak have been seen in Black or Latino Latinx individuals. That it breaks down to about roughly 60% of cases total. Demetre is going to talk a little bit more in detail about how this links to vaccination a little bit later. Next slide, please. Oh, before I go into this, I should mention on May 18th, 2022, we identified the first case of Mpox in the United States. And then in April 25th, not that long ago, 2023, we were happy to reach 7 days on that epi curve of 0 cases. Then a few days ago, a Chicago cluster popped up on the scene, which is actually the largest number of cases reported in the last several weeks. This cluster is not a cause for alarm. It is instead a cause for a call for action, as Dr. Daskalakis mentioned before. So we are here to ask all of you for your action and get people vaccinated with 2 doses of the vaccine. So now let's move along to the wastewater surveillance system. This is a relatively new surveillance system that has been used in COVID and Mpox as well. This surveillance system shows that Mpox is definitely still here in the United States. It is circulating around in our wastewater. And that's right, folks. Wastewater is what you guys are all thinking it is. Wastewater is actually sewage and or runoff water. And Mpox virus can be found in untreated community water throughout the United States. But good news, currently we have very mild detection. Right now we show 1 consistent detection and 1 intermediate detection. At this time, the consistent detection is in Virginia and has been for a good bit. Good thing though, CDC has been in contact with Virginia multiple times, and they think they've actually identified the source of that one. And Texas has showed up as an intermittent detection area. The intermittent detection area, it changes from week to week. This graph is updated weekly. Currently, consistent detection is identified as 80% or more samples that has had detection within the last 4 weeks and a detection within the last 2 weeks. Intermittent detection, however, is between 1 and 79% of samples that are showing detection within 4 weeks and also a detection within the last 2 weeks. And with that, next slide, please.
Thanks, Dr. Romanek. Thank you, Nikki. So I'm going to move on to talking, giving you some updates about vaccine and also frame why we're asking you to come to the Hall of Justice, why we're putting that superhero bat signal up to ask for your help. So the CDC has put out some very important modeling toward the end of March. So they use a mathematical model to ask the question, how high vaccinating do you need to go to prevent Mpox outbreaks and to prevent large ones? So the first question, what they found is the more immunity that we have in the community, the lower the chance is that we'll have any outbreaks. That means higher vaccination equals lower risk for an outbreak. So even though no vaccine is perfect, even imperfect immunity in many people means a lot of immunity in the population. And then the result is that we are less likely to have any outbreaks at all. But also, if we vaccinate more than 35% of the folks who could benefit from the vaccine, not only are we protecting ourselves from outbreaks, but we're also preventing larger outbreaks. Anything less than 35% means that we are likely going to be at risk for an outbreak of equal to larger size than the one that we've already experienced. So though it's a model, I think it really gives us a clear sense we are not done with our job. We need to use that superpower, that superhero strength to make sure that we get our community vaccinated because we know our community is motivated. Now, it's not just about showing the modeling. CDC has been amazing in being very transparent in what we're seeing on the ground. Although these slides look, the bars look really small, they may be hard to see. Don't worry, this is available online at the CDC website. And it really tells you state by state, and in some case, city by city, what percentage of people have gotten the first and second doses of vaccine. In the United States, we're squeaking by. First doses have happened in 37% of people who could benefit, and full vaccination, 2 doses, in 23%. Again, we have not finished the job, and we are at risk for ongoing and future outbreaks. Now, the vaccine works and it's safe. I'm not going to go into a lot of detail, but a lot more data will be coming out in the next few days that will again reinforce that this vaccine is effective. Nothing is 100%, but getting that force field up to level 10, as high as we can get it, in as many people as we can, is the recipe to controlling this outbreak and preventing future outbreaks. It's important to say that not only does the vaccine work, but we have really good data from multiple sources that the vaccine is safe. Usually what we hear about are local reactions, like people will have a little swelling or redness at the site of the vaccine, but otherwise nothing really to report. So who should be vaccinated for Mpox? As we are asking you for this big favor to help us magnify this message. First, it's our people: gay, bisexual, other men who have sex with men, transgender and gender diverse individuals, especially if they have any signs or history of things that could put them at risk for Mpox. People who have sex at sex venues or large events or festivals, or have sex in a geography with Mpox transmission. And remember, given what we're seeing with the wastewater, really we should think about that across the country, given the fact that there is probably circulating Mpox. Also, people living with HIV or other weakened immune systems who may have a recent or future exposure should be vaccinated, and all of their sex partners. Also, really important, it's not just about their risk in the past. Are they thinking about having any of these experiences in the future? That means they qualify for vaccine. And you don't have to grill people, and public health won't be grilling them about their lives in too much detail. So we don't have stigma as a barrier to get the vaccine. If someone asks for the vaccine, that is enough to get it, which is really important. So this is how we're doing so far. We have some great success. We have a very good supply of vaccine. We have many places to get the vaccine to across the country. 1.2 plus million doses have been administered in the US so far. The curve below is really our challenge. It looks too much like the curve that we saw with cases. Instead, what we need to see is that tail of the curve on the right side. It needs to go up, because we need to build new protection and finish the job of protecting people who haven't gotten their first dose or second dose of vaccine, so that we create that force field to protect us from Mpox and also larger Mpox outbreaks. It's also important to talk about equity. And I think Admiral Levine really made the point very clearly. If we're not all advancing, none of us are advancing. And this is a slide that the CDC produced through a really interesting analysis, asking what is the ratio of people who have Mpox to those who are getting vaccinated. And what we see is that for every one white person with Mpox, 43 have been vaccinated. For every one Hispanic or Latinx person with Mpox, 17 have been vaccinated. And for every 9 black people with for every one person who's black with Mpox, 9 people have been vaccinated. So when I saw this slide, I said, wow, this looks really familiar. It looks just like the prep to need ratio in the United States, which is the same kind of ratio. What percentage of people are on PrEP compared to the number of cases of HIV in their community based on race, ethnicity? It's an identical curve, really making the point we need to focus on equity to be able to succeed. And the fault lines that we see that allow this to happen are deep. So whatever we can do to increase vaccination and to increase the word on Mpox and HIV is critical for us to advance the cause of our entire community. Also, Nikki brought up that there is an outbreak in Chicago, a small cluster, and many of the individuals are vaccinated. Now, that means that we may have done the vaccine job right, and we're actually vaccinating people who potentially could be exposed to Mpox. So we would expect to see vaccines in vaccinated people, but we are investigating with CDC in detail, as well as the Chicago Department of Health, to learn more about these cases. Nevertheless, the message has not changed. So first, if somebody has a rash or a lesion, they should get tested for Mpox. I think Admiral Levine said that already, whether they've had a previous vaccine or infection or not. Really important that testing is a tool here. We are not done vaccinating. And like I said, even when infection's not prevented, vaccine has other benefits. These folks are having mild disease and they're not getting hospitalized. Also, even imperfect immunity still means good immunity if we get a lot of folks vaccinated. So it reduces symptoms, it prevents hospitalization, and also prevents infection. So we need to finish that job and get really to a much higher level of vaccination in our population. And it is a powerful tool to protect personal and public health, but it's a part of a toolkit. We need to make sure that people know about Mpox and how they can protect themselves using every tool. For some people, that may also mean temporarily changing some behaviors in their sex life. So really, it's really important to make sure people remember Mpox, keep it on their list, and definitely get those shots. I will pass it on to Nikki again for a quick treatment update.
All right, thank you very much, Demetre. Next slide, please. All right, quickly, I'm just going to scan over this slide. So there are a couple of ways to get a new investigational drug called Mpox. CDC has prescribed almost 7,000 has prescribed the medication to almost 7,000 patients. The age and gender identity and race ethnicity breakdown for those patients is similar to Mpox cases. Next slide. Now I want to talk a little bit about, there it is, a STOMP study. This slide just serves as a reminder of how important this study is. This study is going on in the United States to see if TPOXX actually works to treat Mpox. CDC data currently tells us that TPOXX is safe, but we need to learn if it works. The study is revolutionary in that it has taken a new approach to access. Patients and providers can enroll remotely by calling the phone number, in addition to multiple sites in the United States as well as globally. If you know somebody that has Mpox, or you yourself get Mpox, please call the phone number and you can get cycled into getting medicine if that's appropriate in your case, or you'll be randomized into the study. It's very important because as cases decrease, which is ideal, of course, it's harder to learn more about this medication. And with that, I will turn it over to Demetre.
Thanks, Nikki. So I want to talk briefly about something that's called a syndemic. And I think Admiral Levine really framed it very well. You can't think about Mpox without thinking about HIV, and you can't think about HIV without thinking about Mpox. So what do I mean by a syndemic? So this is where I take my teacher hat. I put my teacher hat on. I'm going to teach you all this word if you don't know it. Syndemics are epidemics that interact with each other, and through that interaction, really increase the adverse effects that they have on the health of our communities, especially as they're facing systematic, structural, and other inequities. Let me put it in motion. So we saw this happen in real time. Mpox interacts with HIV and STIs. We see that folks who have Mpox and HIV are more likely to be hospitalized. They're more likely to have severe infection. And yes, many of them were more likely to pass away compared to people who did not have HIV. There's a high percentage of individuals who have sexually transmitted infections and Mpox. They live in the same zip code. They interact with each other. Something biological as well as environmental may make these infections worse together, especially when made worse by other areas like drug use and mental health. It doesn't end there. So a syndemic is generated when this all happens in the context of what we call negative social determinants of health. Some examples are systemic racism, homophobia, transphobia, and limits to access and housing. When all of those happen, that little ball of interacting health challenges is made more dense and strong. It becomes a syndemic, and it increases synergistic impact on affected communities. So more than its some parts, that ball is more impactful to the people who are potentially affected by these infections. So what I mean by that, and what we've seen, is that we know people who are homeless, people living with HIV, they've had worse outcomes. So it is so important that we put Mpox on our list. As you do all the work that you do to sort of magnify health messages to community, remember, you can't think Mpox without HIV. You can't think HIV without Mpox. An HIV test should make you think about an Mpox vaccine. An Mpox vaccine should make you think about an HIV test. I'm going to pass it over to Nikki to move into some of our resources that we have to offer you and that we really need your help magnifying.
Thank you. All right, go ahead and do the next slide, please. All right, overarching message that we want to shout from the rooftops. Please share these messages. CDC developed a fantastic resource called Get Healthy and Ready for Summer 2023. This research includes everything you need to know about traveling. Next click. Perfect, thank you. On this website, it talks about everything from travel outside the United States to travelers' health recommendations. And in addition, an extensive list of sexual health resources that includes HIV and STI testing. Also gives a great overview of all vaccines needed. Of course, it includes the Mpox vaccine, get 2 doses. It also includes COVID because COVID is still circulating in the United States and globally, even though the PHE is over. It also includes overdose prevention tools. So please share this website before your Pride events, ideally on your website, so that those that attend will hopefully get their vaccine prior. Next slide.
Hey, Nikki, can I add one quick thing about it? This website is not just about travel. So even if travel is down the block to go to the Pride event, it has all the information that you need to make sure that you're ready for events as we approach that summer festival. So just wanted to highlight that it's not just about travel, but also about traveling down the block. Thanks, Nikki.
Thank
Sorry
you.
about that.
Next slide. All right. In addition, we have created I like to call 1.75 pager that is a deep dive slide. This includes info from everything from steps on how to embed the CDC Mpox vaccine locator onto your own website, to searching that locator to find the Mpox vaccine ahead of Pride season. It also includes fantastic resources such as palm cards and 16 fantastic videos that our own Dr. Daskalakis is the star of. And those videos are the most frequently asked questions and very clear and simple answers. In addition, those videos come in Spanish. This 1.75 pager also goes deeply and dives deeply into STI health as well. And it's more of like a syndemic 1.75 pager is how I like to think of it. Next slide. And recently, over the last week, the wonderful CDC also developed 2 more websites. We have one website that focuses on the most recent Chicago cluster, talks about Mpox infections after vaccination and the importance of vaccination, and also a website that focuses specifically on Mpox vaccine and its relation to spring and summer events, including resources for clinicians, event organizers, etc. Next slide. Here is a slide of our fantastic, fantastic partners. Everyone that we have talked to over the last couple of months of the roadshow that we have gone on is listed here. I'm sure we're missing a few. There have been an incredible amount of partners. Without these partners, I don't think that this outbreak would be where it's at right now. There's a lot of hope, but still caution as we try to get everybody vaccinated that is at risk. If you see something is missing and there's somebody that we should be talking to that we're not, please reach out and let us know. And we would love to get in contact with those folks. So overall message here, these resources, we've provided them to Interpride, and they can send them to all of you. We hope that you guys get the message out, and we appreciate it. Next slide, Dr. Daskalakis, and over to you.
Thank you, Nikki. And so this is the part where we put up that bat signal. So this is where we're going to need your help. And we have some really good ideas of how you could potentially help us and also help the folks that are really listening to you and looking to you, because again, you are supporting their superherodom too by making sure that you create spaces where they're able to celebrate their pride with joy. So here's some ideas. Help promote resources that lead people to good sexual health services, including Mpox vaccine. I know we've already talked about it, but that Get Healthy and Ready for Summer 2023 website is great. And it is a one-stop hub for so much information. Add the Mpox vaccine locator or the other service locator to your website. We can provide the code. In fact, that 1.75 pager that Nikki was talking about has a step-by-step list of instructions of how to do it. That's going to mean that when people come to learn about your event, they can also find out where to get Mpox vaccine. You are trusted messengers. You are people that our community listens to. So help us spread the word to help stop Mpox. Knowledge is power in our community. We've seen it once. And I know that we can see it again if we have any reason to. So we have to help raise awareness about Mpox. Remind people that if they're sick or have a rash, they should get tested and avoid events. We'll keep reminding them, but good for you all to remind them from your perspective too. And remind them that the time to get vaccinated, if they haven't done it, is now. If they have not gotten their second dose of vaccine, it's never too late. So this is really getting us summer ready. And as I joked, it's not just about summer body this year, it's also about summer antibody. So let's see if we can get that done. Connect with your local public health department. Message that people should get their vaccine for Mpox before we kick into full gear. It's really a great idea to sort of message that as you're planning your events to the people who are coming and say, hey, we want you to make sure that you're healthy and ready for our event. Here's a bunch of stuff. Go to get healthy and ready for summer 23, and then motivate the effort to get vaccinated. And consider having vaccines at your event. So there's a lot of pathways, talking to your local health department. And if that's a problem, we'll make sure that you have ways to contact folks at CDC who can actually point you in the right direction, so that we can offer you the vaccine if you're interested. And I sound like Admiral Levine, not surprisingly, we need you to lead with joy. This is not scary. This is about making sure that people are able to enjoy Pride, have a joyous season, really be able to really fully realize who they are and have a couple of less things to worry about. So we really want to make sure that people have fun, make sure they're protected, make sure that they're able to celebrate themselves and their community, and have Mpox one less thing that they worry about because they already have a plan. I'm going to leave this up for 1 second, but we can totally circulate this information as well. These are email addresses where you can find the amazing Nikki Romanek and the Guess I'm Okay, Demetre Daskalakis. So please feel free to drop us a line. So thank you very much for your attention, and I'm going to hand it back over to Natalie.
Thank you both, Dr. Romanek and Dr. Daskalakis. This was really amazing. We've had some really great information that has been shared today. And a lot of folks in the chat are just really excited about having this information and are very thankful for this. I wanted to make sure that, as we talk about vaccine and as we talk about ways that we can protect ourselves, I wonder if we can go into a little bit more information about how Mpox is actually transmitted so that folks really have that information, so they know.
Great. Natalie, I'll start, and then Nikki, you should fill in anything that I miss. So I'll start by saying that that Mpox traditionally is spread through close skin-on-skin contact. What we have seen during this outbreak is that it has also happened primarily through sex, through close skin-to-skin contact that happens in sex. The majority of individuals who have had Mpox have been cisgender men. Most of them are men who have sex with men. So close skin to skin contact, and it appears as if really intimate interactions that happen in sexual contact can also transmit the virus.
Perfect.
Thank
Thank you
you.
so much for that. I just wanted to make sure that folks had that awareness as we talk about, ways to prevent, ways to protect yourself, just making sure that folks understand, how this potentially could happen. Um,
Yeah, Natalie, it's about
yeah.
layers. It's like, so people, what I like to say is knowledge is power here. So knowing that this is that it transmits in a way that sort of happens around sex really lets people make their own personal plans so that they can really mitigate or modify their own risk. One thing that everyone should do who could potentially benefit is get vaccine along with making those plans about behavior.
Yes,
Thank you.
perfect. Thank you so much for that. We did
Yeah.
have a question from the community around, where to learn about where to get vaccinated. And I saw that on the Get Healthy and Ready for Summer. Really love that title, by the way. Get Healthy and Ready for Summer 2023. There's an opportunity to really look at places to get vaccinated. But a community member had a question about, will there be um, opportunities for folks to have this information readily available at Pride festivals? Is there a connection that you all are making with Pride networks?
So I'll start and say, so this is like one of the places where we're actually making sure that you know how to make the connection if you're sort of thinking about your Pride events. And so the best strategy is really local health departments. So I think many of you already partner with the local health departments, but that's a really great start. We also have a lot of resources that could be really helpful to you. And so we'll make sure that you have them. But I think that really the messaging that we have, you can always link to what we have or what your health department has, but then also magnifying that message from from where you sit as a trusted person in the community is really important for us to get people to think about Mpox again.
Thank you. So I do have another question, just shifting gears here really quickly. We talked about some of the social determinants of health, like some of the negative impacts, how housing, racism, and some systemic barriers that exist can really impact folks' access to care sometimes and their increased susceptibility to impacts. I'm wondering if we could talk a little about stigmatization and if you feel like that plays a role in folks potentially not wanting to talk about it, not getting vaccinated, or stigmatization about, sexually transmitted diseases, STIs, and how that sort of plays a role in folks getting vaccinated or talking about this issue.
Nikki, do you want to start or do you want me to
You
do it?
go right ahead with that one.
Okay, so stigma is, I think that we know that Mpox, from talking to the community really closely, is stigmatized, and we've worked really hard to reduce some of the things that were overtly causing stigma. So examples are removing the need to really go deeply into your risk factors for Mpox when you try to get the vaccine, and also making sure that the vaccine can be given in different parts of the body, so we avoid any temporary marks that can happen from getting the vaccine. With that said, stigma is real, and I think that really this is why the conversation here with Pride, with Interpride, is so important, because you all have a space where people feel free, and where stigma in effect is neutralized by the fact that there's so much joy and community love that wraps around people to make sure that they're able to celebrate their identities and their lives. So that's why we definitely think that, like, one of the ways to combat stigma specifically is to make sure that you all help us to magnify the message, and that we offer you the resources to make sure that your folks are educated on Mpox, and potentially that you have the ability to access vaccines. I'll also say, Natalie, that we did a lot of work to make sure that it wasn't just like the HIV STI space where we made Mpox sort of a priority. So we've been working really closely with SAMHSA, which is the Substance Abuse Mental Health Service Administration, as well as HUD, which is the Housing Administration, to make sure that all of their providers have Mpox on the list of what they do with the folks that they serve. And actually, both of them have created really exciting flexibilities in their resources. So when someone comes for, let's say, a syringe in a syringe exchange program, in that conversation, people are actually supposed to talk about Mpox, and also can use that opportunity to refer people to vaccine. So it's really about putting services and prevention where people go. Prides are one of them, but also non-medical places where they may seek service are really important, and we worked really hard to do that. So this is just a part of that bigger plan, and so this is a really important component in the formula to address stigma. So the Pride voice is so important to us.
Thank you so very much. That was our last question for the day. I would love to open it up to you, Dr. Daskalakis and Dr. Romanik, for any closing remarks. Yeah.
So I saw there's one question that I saw flying around, which is, can prides do vaccines? The answer is partner, partner, partner. You all know your neighborhoods better than anyone, and so think about partnering with your local LGBTQ focused clinic. Think about talking to your HIV STI services in the sexual health piece of your health department. The answer is that there are resources that have gone to local public health to support this work, and there's vaccine to support it. So we're happy to be a bridge for you all to identify ways that vaccine can actually come to your event or near your event, because they have mobile units sometimes. So lots of good ideas. So I think I want to just end with, at least from my perspective, like, we talked about Chicago and we talked about the work that has to be done, and so this is all about a call to action. And like, our community, we know how to do this. We have muscle memory. We have muscle memory from HIV. We have muscle memory from COVID. We have muscle memory from Mpox. We got it. And so, as superheroes, it's time to flex. So flex that muscle and flex it with us so that we can really help protect the community. One of the things that thrills me is when we get to show how LGBTQ event organizers and prides step up. People who are not in our community are like, wow, like, who's to expect this? And it's like, here, we expect it because it's what we do. So I want to just echo what Admiral Levine said. I believe, and as I've said for decades in HIV, the best way to end an epidemic is with love and you all are the ones who have the love. So if we do this with joy and with respect for the community, we're going to actually show folks yet again how good the LGBTQ community is at controlling any health challenge. I'm going to pop it over to Dr. Romanek.
Well, that was quite a closing. um, I'm going to go ahead and add partner, 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 but also message, message, message before your event if possible. We trust you guys and lean on you to get the word out to everyone that you know and everyone in your community. As he mentioned, you guys know the right people and the right ways to message to your community. So we want to urge you, those resources, I already sent them over to Interpride. So please feel free to message them out in whatever way you see fit. And whatever we can do to help bolster your message, we're here. We're here for you. And please, please reach out. You have our emails. We would love to stay in contact and help out. Thank you.
Ooh, I have one more thing because I love to talk. I just want to say, Natalie, Ryan, thank you. So I know the ability to sort of talk to Interpride and all the folks that interact with you is so important. Keep us on speed dial as well if you need us to give you an update. We're so happy to do it. So I don't know if I can do, there's no symbols on this one, but I'm sending hearts and love. Thank you for the opportunity.
Well, thank you very much. We are very appreciative of the ability to have this conversation today. I want to thank Dr. Daskalakis, Dr. Romanek, and Admiral Levine for being here with us today for this really important conversation. Very informative, and I love that we get to do this work within joy and love and like reducing stigma and really understanding where we are in this world and what we have to give. This idea of our identities being our superpower and like how do we plan to use that power. And I just really love that we get to talk about this really serious issue, but do it in a way where it comes from a space of joy and acceptance and kindness and love. So thank you for all this information. We will have all of this available on the Interpride website so that everyone can reference back. We'll share it out with all of our members. So please go to interpride.org to look at all of this information. This will also be on all of our platforms so that folks who weren't able to join us today will be able to get a chance to see this. Again, I want to thank you, Dr. Daskalakis. I want to thank you, Dr. Romanek, and I want to thank Admiral Levine for joining us today. And I'd like to thank the community for being here with us. So on that note, thank you all. Have a great rest of your days.
Thank you.